Welcome to my channel. Welcome to where we simplify anatomy, and here we also learn anatomy with so much fun. Let's look at the pericardium. The pericardium is a tough sac that surrounds the heart, outer covering of the heart. So the heart is not just seen to be placed in the thoracic cavity, it is also seen to be covered with a double layer sac that is called the pericardium. We can relate it to an orange with its peel still intact. So you have the orange being the heart, while the peel that surrounds it being the pericardium. So the heart is enclosed in this double layered sac that is called the pericardium. The pericardium is seen to extend from the base of the great vessels. This is where we have the great vessels. So you have the pericardium extending from the root of these great vessels. You see it extending downwards and covering the entire surface of the heart. So this is the heart that is seen on the inside, while on the outside we have the pericardium that is seen to enclose it. So this is the configuration of what is presented here. And we already said that the pericardium is a double layer sac, which means that it is made up of 2 layers. And this would unfold as we go further with this lecture. The pericardium is a very vital structure, and it is important for us to learn the anatomy of this structure, because any effect or damage that is imposed on the pericardium will affect the functionality of the heart. We will see how this will also be unfolded as we go through with this lecture in establishing the relevance or importance of the pericardium as it relates to the functions of the heart. So if any damage occur to the pericardium, it will affect the functions that the heart exhibits. So let's go to the functions of the pericardium in trying to establish the functions that the pericardium exhibits in respect to the heart. We already said that the pericardium is a double layer structure that is seen to enclose the surface of the heart, and it is made up of a fibrous layer and also a serous layer. It helps to give a form of structural barrier or protection, or like a guide to the heart. So we have the heart on the inside highlighted in red, and we have the pericardium highlighted in blue surrounding it. So you have the pericardium giving like a form of structural support to protect the heart. And of course, this protection helps to prevent the spread of infection to the heart within the thoracic cavity. Infection that occur within the thoracic cavity will be prevented from reaching the heart because of the protection that it has by the pericardium, which is a tough sac that helps to enclose it. So it helps to limit the spread of diseases or infections to the heart, giving like a physical barrier to it. Also, going further on the functions of the heart, it helps to keep the heart in place. So the pericardium is not only covering the heart, it is also helping to keep the heart in place. There is a specific layer of the pericardium that is tapered to the diaphragm. This is the diaphragm highlighted in yellow, and we know that the diaphragm helps to separate the thoracic cavity from the abdominal cavity. So there's a layer of the pericardium that is seen to be connected to the diaphragm, and as this connection is created at this point, it is helping to hold the heart that is highlighted in red and seen on the inside, helping to hold it in place. So that is how it helps to limit the movement of the heart. There's a layer of the pericardium which will be unfolded as we go through with this lecture that is seen to be connected to the diaphragm. And as it is connected to the diaphragm, it's helping to keep or limit the movement of the heart. So that is what the pericardium also does. Going further on the function, it helps to prevent hyper expansion of the heart. And why it does this is because we said that the pericardium is a tough sac, which means that this sac cannot be stretchable and cannot be expanded. So because of this reason, as the heart begins to expand or contract, which is in the quest of helping to pump out blood or receive blood, the pericardium helps to limit the hyperextension of the heart. Because this sac is tough, it is not expandable, so it cannot expand. So as the heart is expanding, it's helping to limit or control the rate at which it expands. So that is another function that the pericardium also does because of its toughness, which means that it cannot be expanded. If the pericardium can be expanded, it is going to further give more space for the heart to also expand. But because it cannot expand, it is not stretchable. As the heart expands, it's going to help help to control or limit the rate at which it expands. So this is another function of the pericardium. And of course, this will help to modulate the functions of the heart as it relates to expansion and relaxation. Also, it helps to reduce friction because there's also a layer of the pericardium where we have serous fluid that helps to lubricate the surface of the heart so that the heart can exhibit free movement during the process of expansion and also relaxation. So we'll also be unfolding this as we go to the structural configuration of the pericardium. So going further, the pericardium also acts as a shock absorber. The pericardium helps to absorb this shock so that the impact does not get to the heart. So this is another function of the pericardium. They also help to support the physiological activities of the heart. We know that the heart is responsible for pumping out blood. We've highlighted a number of functions of the pericardium that will be needed to support this function. So let's look at the location and surface marking of the pericardium. We know that the pericardium surrounds the heart, and of course, there's going to be a kind of similarities in their surface marking and also their location. So let's look at where the pericardium is located. We know that the pericardium, we've said, encloses the heart, and we know that the heart is located in the middle mediastinum. If you've not checked out my lecture on the mediastinum, please kindly go and do so to keep yourself updated. The pericardium is specifically located in the middle mediastinum, which is a portion of the inferior mediastinum. So this is the specific location of the pericardium. Anteriorly, the pericardium is bounded by the second to the sixth costal cartilage, while posteriorly, it is bounded by the T5, T6 thoracic vertebrae. And laterally, of course, we have the lungs and also the surrounding pleural membrane. We know that the heart is located at the central portion of the mediastinum, where we have the lungs on both sides. So laterally, they will be related or bounded by the lungs and also the pleural membrane. Inferiorly, we have the diaphragm, and this is the diaphragm highlighted in yellow. The diaphragm is like a demarcation between the thoracic cavity and the abdominal cavity. And we know that the heart rests on the diaphragm. So also the pericardium will be related inferiorly to the diaphragm. So inferiorly, we have the diaphragm. Superiorly, we have the transverse thoracic plane. And this is the transverse thoracic plane highlighted in red. This is the plane that, of course, separates the superior mediastinum from the inferior mediastinum. You can see how these structures are related to the pericardium. So let's look at the structural configuration of the pericardium. We said that the pericardium is a double-layered sac. Some tests will tell us that it is divided into 3 layers, and we'll see the basis onto which that is also established. For me, I would like to divide the pericardium into 2 layers. First, we have the serous pericardium, which is the inner thin layer. This is made up of a serous membrane that is very thin. And we have on the outside, we have the fibrous pericardium, which appears to be very tough. So we have the serous pericardium highlighted in blue in this image here. And of course, it is thin and it is on the inside. While on the outside, we have the fibrous pericardium, which is highlighted in yellow. This layer is very tough. So we can see how the division of the pericardium is established, while we have a further subdivision of the serous pericardium into the visceral pericardium, and this is the visceral pericardium on the inside that is closely related to the heart or closely attached to the heart. Then we have the parietal pericardium, which is the outer layer of the serous pericardium, and this is the parietal pericardium, and this, of course, is seen to be located external to the visceral pericardium. So you see that the serous pericardium is further subdivided into 2. We have the visceral pericardium and we have the parietal pericardium. Where we have on the outside, we have the fibrous pericardium. And this is why some tests, we divide it into 3. And the 3 layers will then be the visceral pericardium, the parietal pericardium, and also the fibrous pericardium. So you can understand the logic onto which the division of the pericardium can be made into 2 layers or 3 layers, depending on the test we are reading. But it's always good for us to spread it out in this format so that we can easily understand how the layers are expressed. So let's look at the serous pericardium. We said that the serous pericardium is the internal layer. There's some form of dramatic configuration that is seen within the serous pericardium. We said that the serous pericardium is further subdivided into two. We have the visceral pericardium and we have the parietal pericardium. We already established how these are related and established. If you look at the visceral pericardium, this is the visceral pericardium. If you trace it, you see that it has a close relation with the heart. It is closely attached to the surface of the heart, and this is the visceral pericardium. More on the outside, we have the parietal pericardium. This is seen to be external to the visceral pericardium. So this is the parietal pericardium. The two layers are sublayers of the serous pericardium. There's a form of event that occur. If you look at it towards the root of the great vessels, you see that there's a form of continuation around this region that is arrowed in black. So if you look at the visceral pericardium here and the parietal pericardium, there's a form of continuation that is expressed around this region. So this continuation tends to create like a form of space around the heart because of the continuation that is created between the visceral layer and the parietal layer around the root of the great vessels. So we have the formation of the pericardial cavity. So this is the pericardial cavity, which is the cavity that is seen to be formed between the visceral layer and the parietal layer of the serous pericardium. So this space is called the pericardial cavity. And within the pericardial cavity, we have fluid embedded within it. And it is this fluid that is responsible for lubricating the surface of the heart so as to reduce friction and allow easy movement so that the heart can contract and relax at free will. Going further, let's look at the pericardial sinuses. These are spaces that are created by the serous pericardium. This is another form of transformation that is seen to be formed by the serous pericardium. We've talked about the pericardial cavity, which is formed by the visceral and the parietal layer of the serous pericardium, which creates a form of cavity. In the pericardial cavity, we have serous fluid, which helps to lubricate the surface of the heart. And if we go back to the functions, when we try to highlight the functions of the pericardium, we said that they help to lubricate the heart, and this is where this is also established. So going further, the pericardial sinuses is another form of transformation that is seen to be exhibited by the serous pericardium. We have sinuses, which are like impressions or spaces that are created in pericardial sac, and this is formed as a result of pericardial reflection. This is very important during surgery, and it's also important in creating space for expansion, and we see how this is expressed. So let's talk about the sinuses that are created by the serous pericardium. The first one I would like to highlight is the transverse pericardial sinus. From the name, is a transverse tunnel that is seen at the upper border of the heart, and it is seen behind the ascending aorta and the pulmonary artery. So you see it separating the arteries from the veins. These are the veins, these are the pulmonary veins highlighted in red at the inferior part. And we have the superior vena cava and the inferior vena cava at this side. In this area, we have the veins, and up here, we have the arteries. This is the aorta and this is the pulmonary artery. So behind the ascending aorta and the pulmonary artery, we have a pericardial reflection around this side, and this is called the transverse sinus. This transverse sinus is important during surgery because around this area, the hand can be put into it because of the space that is created, so that these two vessels, which are the aorta and the pulmonary artery, can be ligated during the process of surgery. So it's like a tunnel where the hand can be fixed into, because it's a space that is created around that region, so that the vessels can be ligated or tied during the process of surgery. So this is one relevance of the transverse pericardial sinus. The another sinus that we see is the oblique sinus. The oblique sinus is like an inverted J-shaped reflection, and is a reflection of the vena cava and also the pulmonary vein. We already know that the superior and the inferior vena cava will merge to become the vena cava, and we have the four pulmonary veins around this region. So this J-shaped configuration that is formed as a reflection of the vena cava and the pulmonary vein is called the oblique pericardial sinus. And this is seen at the posterior part of the heart around these veins. And what it does, because we say the heart is located more to the left, so this image will be directed more to the left. It means that this oblique pericardial sinus will be formed around the left atrium. So it's going to allow a form of expansion of the left atrium. So what this oblique pericardial sinus does is that it helps to create space for the expansion of the left atrium, because it's a space on itself that is created as a result of pericardial reflection. So this space will further create space for the left atrium to expand so that more of the oxygenated blood will be taken into it, and of course will be used to supply the body tissues with oxygen and nutrients. So let's go further to see the fibrous pericardium. We already established that on the inside, we have the serous pericardium that is highlighted in blue. On the outside, we have the fibrous pericardium. This fibrous pericardium is highlighted in yellow. And of course, we say that it is the external layer of the pericardium and it is tough. So this layer does not allow any form of expansion. And when we try to also highlight the functions of the pericardium, we say that they help to prevent the hyper expansion of the heart because of the toughness of the fibrous pericardium. So that when the heart expands, there's going to be a form of limit and control by the fibrous layer of the pericardium. And that is how that function is established. In trying to relate the functions with the structure. So this is the fibrous pericardium highlighted in yellow. This structure is connected to the central tendon of the diaphragm. If you look at how it is being held, we see that at the inferior part, there's a strong connection between the fibrous layer of the pericardium with the diaphragm. This is the diaphragm highlighted in red. So it tends to connect or be attached to the central tendon of the diaphragm, and also to add that when we try to highlight the function of the pericardium, where we say that it helps to control or hold the heart in place because the outer covering is connected to the diaphragm. So it's helping to hold whatever it is that is on the inside in place because of the fibrous layer of the pericardium being connected or attached to the diaphragm. So we can try to also relate the structural configuration of the fibrous pericardium in terms of where it connects to also use it to establish as the function of the pericardium, where we highlight that it helps to hold the heart in place. So this is the diaphragm highlighted in red, while the fibrous pericardium is connected with. Let's look at the attachment of the fibrous pericardium. We already highlight one of its attachments at the inferior part where it connects with the central tendon of the diaphragm. But let's look at other attachment that it has. If you look at it superiorly, it is pierced by the great vessels. And at this point, you see that it is connected with the adventitia of the great vessels. As the fibrous pericardium connects with the adventitial layer of the great vessel, it's also helping to give a form of structural connection to it at the upper part. So helping to hold the great vessels onto the mouth or the superior border of the heart so that they can be well placed. This is at the region where it merges with the adventitial of the great vessels. So inferiorly, we already established that it merges with the central tendon of the diaphragm. Then anteriorly, we have the sternopericardial ligament. Why the sternopericardial ligament is seen at the anterior part of the pericardium is because it connects the posterior part of the sternum to the anterior surface of the pericardium. We know that anterior to this region, we have the sternum. So the posterior surface of the sternum will be connected to the anterior surface of the pericardium by the sternopericardial ligament. And that is why this is established as the anterior attachment of the pericardium. We have vessels running at the lateral region of the pericardium. So we have the pericardiophrenic artery. This is the pericardiophrenic artery highlighted in red. We have one on this side and one on the other side. We also have the phrenic nerve. This is the phrenic nerve highlighted in black. This is the phrenic nerve highlighted in black. So we have the phrenic nerve and the pericardiophrenic artery running at the lateral wall of the pericardium. It's also good for us to establish this. And as the artery and the nerve runs through it at the lateral border, they're also helping to supply it and innervate it. So let's look at the blood supply of the pericardium. The pericardium is supplied by the pericardiophrenic artery. We already established this. The pericardiophrenic artery is a branch of the internal thoracic artery, which is a branch from the subclavian. Then we also have minor contributions from the musculophrenic artery. The musculophrenic artery is one of the terminal branches of the internal thoracic artery. We have the esophageal artery, the bronchial artery, and the superior phrenic artery. These three arteries are branches from the thoracic aorta. They also give minor supply to the pericardium. Then we also have the coronary artery, but the coronary artery supplies only the visceral pericardium. The coronary artery supplies the heart tissue with oxygen and nutrients. We would not say that because the heart pumps out blood, it does not also need to feed its own cells with oxygen and nutrients. And that is why we have the emergence of the coronary artery around the ascending aorta to supply the heart with oxygen and nutrients. So branches from the coronary artery also supplies a region of the pericardium. And the specific region of the pericardium that the coronary artery supplies is the visceral pericardium. We know that the visceral pericardium is a layer of the pericardium that is closely related or attached to the heart. So after feeding the heart tissue with oxygen and nutrients, it also gives branches to supply the layers that is close to it, and which is the visceral pericardium. So let's look at the innervation of the pericardium. The pericardium is innervated by the phrenic nerve. The phrenic nerve also gives motor innervation to the diaphragm, but gives sensory innervation to the pericardium, and this includes pain and temperature sensation. The phrenic nerve, due to its origination from the C3, C4 to C5 cervical spinal nerve, send referred pain to the shoulder region due to the origin of the phrenic nerve. So let's look at this clinical anatomy, pericarditis and also pericardial effusion. Pericarditis is an irritation or swelling of the pericardium. It is specific to the pericardium, and it's seen to occur with sharp pain around the chest region. Pericardial effusion is the presence of an abnormal accumulation of fluid in the pericardial space, and this will tend to put pressure on the heart. And why it does this can also be related to the fact that the fibrous pericardium is tough. It cannot be expandable. It is not stretchy. And this is the region that is highlighted in yellow. So when we have excess fluid within the pericardial space, because this cannot expand, it's not creating more space for it, this will tend to put pressure on the heart. And when pressure is put on the heart, it will not be able to pump as much blood as it's supposed to. So it's going to affect the function of the heart. The treatment option that can be done to rescue this situation is by extracting or draining the fluid out of this space. And the specific term for this procedure is called pericardiocentesis. So let's look at this question to see how far we've been able to understand the content of this lecture. And the first question is to describe the layers of the pericardium. The second question is to explain the blood supply of the pericardium. We have established that we have major supply. We have some minor supplies also. Then the third question is to relate the anatomical configuration of the pericardium to its functions. Thanks for watching this video. Let's continue to stay glued to this channel.